Morning after pill is not for regular use. Hi, I am Dr. Anuradha Panda, consultant gynecologist and obstetrician at Apollo Hospital, Jubilee Hills. Today we will be discussing about morning after pills. The morning after pills is what we give for emergency contraception. When we say emergency, it means it can be consumed when you have forgotten your normal contraception, your regular contraception, or there's failure of your normal contraception, means there's breakage of a condom, or there's where there's chance of pregnancy after a sexual assault or rape. These are the conditions where we say in emergency you should take the medication. Morning after pill is usually a levonorgestrel combination. It's a progestin only combination which should not be used on a regular basis. It is not a substitute for your regular contraception. So we see women taking that 2 times, 3 times or 4 times in a month. That is something we should not be doing. If you do that, you end up with problems like irregular periods, you end up with problems like lot of cramps in the abdomen, your periods go haywire, and then you come and go on for other things to be done. So it is usually to be taken only when there is unprotected intercourse with all these things what I have said. Now how does this work? This works by either stopping or making your ovulation ineffective. It is available over the counter. You don't need a prescription for that. It's available as eye pill or unwanted 72. Those are the things which can be kept for emergency use. Now what are the disadvantages of using this? If you use it on a regular basis, you will have irregular period, you may have lot of bloating, you will have breast pain, sometimes there is a lot of cramps in the abdomen, and then you bleed. And the effectiveness, well, you can't say when you use a morning after pill, it works. It's not very effective and depends on what time you use it. In the first half and the last half, well, there's less chance of pregnancy, so it may be effective. But when it is in the ovulation phase, it may not be that effective. Or a woman is obese, then the dose is a fixed quantity. So obese women will have more chance of failure. So do you need to see a doctor when you take this? You can keep it handy and take it as soon as you, after the unprotected intercourse. Mostly it is better if it's taken as early as possible, but not later than 72 hours. That's important. You should not take it after 72 hours. And what are the side effects? It may have nausea. Because the high dose of hormones, you may have nausea, vomiting, breast tenderness. Then there is chance of abnormal bleeding. Mostly after consuming the pill, after 3-4 days, you may have a bleed. Now your period may get delayed. But if it is delayed more than 7 days, you need to do a pregnancy test. Sometimes there may be lower abdominal cramps and more bleeding in the next period. So when do you think you should see a doctor? You need not see a doctor for taking the morning after pills. But if your period is delayed more than 7 days beyond your date, you have to do a urine pregnancy test or a beta HCG and then see your doctor. Or if you have lot of abdominal pains, cramp in the lower abdomen, or bleeding which doesn't stop, those are the indication which you need to go and see the doctor. So the take home message would be, use it as an emergency, not as a regular method of contraception. Use a proper contraception when either pills or an intrauterine contraceptive device, so that you need not resort to using an emergency contraception again and again. If you have side effects or your period is delayed after taking, you should see a doctor. Thank you.